Well, the intense atmosphere medical workers are dealing with is constant, and nurses, doctors, and other specialists have shared their stories of working through the COVID-19 pandemic in a pair of videos called Courage on the Frontlines. Fox 13's Max Roth joining us in studio right now with a closer look at this. Max.
Yeah, and again, a thank you to the folks at Intermountain Healthcare for getting these stories out. You know, Utah's first big COVID spike saw over 100 patients in Utah's ICUs for 2 days. It was July 18th and 19th. Well, it was October 14th that we hit 100 again. And then we kept going up to 200 on November 17th, and we're still above 200 right now, though most of us do not see it, like these people we'll hear from.
Sometimes it feels like there's no end in sight, and we have hope, but for right now, our everyday lives are pretty strained.
With these people here, they're not here for 3 days or a week, or they're here for weeks and months at a time.
For the most part, they're stuck inside themselves. They can't talk, they can't stretch their arms, because if we lose the ET tube, the tube that's helping them breathe, they'll die.
We also put them on their bellies to help them breathe better, but with it takes 5 caregivers minimum to put them on their belly, and so we've had caregivers come in on their days off.
When I come to work, I deal with COVID patients, and when I go home, I don't get to hug my kids. I have a 4- and an 8-year-old. And they don't run to the door anymore because we don't give hugs when I get home. They know that the first thing I do is I shower. And then I get to spend half an hour with them, and I come back and I do it again.
So we had sisters 3 rooms apart getting high levels of oxygen. And for that sister who was ill herself to have the oxygen and the care that she needed to be safe, but to be able to hold her sister's hand as she was leaving this life, and we felt like that was a very powerful moment, but also very hard to watch.
I think that all of our nurses are in the same boat. You know, you'll get a call from somebody after a shift and they just sob because 1 or 2 or 3 patients died in a shift. Sometimes these patients are awake and they know what's going on.
We can still take great care of people, but it's just getting harder and harder to do it because there are only so many of us, there are only so many beds. But, unfortunately, we do have limited resources, and they're being very taxed right now, and we're all really tired.
So those videos from LDS Hospital and from KD Hospital, and if you'd like to see the full ones, we are linking to them from fox13now.com. These folks are not making a big deal out of these videos. The last time I looked, they had about 1,400 views on YouTube. We think that's not enough. Their efforts deserve our thanks and respect, but they're not asking for that in these videos. They're asking us to see what they see before we decide what we'll do about it. Live in studio, Max Roth, Fox 13 News, Utah.